Joining me now for more on this is Dr. Kieran, Ontario's Chief Medical Officer of Health. Dr. Moore, thanks so much for joining us. First, can you shed some light on this tragic case, share any additional details?
Well, I have to commend my minister. I can't say it any better than she has. It is indeed a sad day. It's a stark reminder of the seriousness of this virus, this sad and tragic event is preventable through immunization. Our condolences to the family and my heartfelt thanks to all of the healthcare workers that helped support the family and the child. But we have to renew our efforts to try to vaccinate our communities, to address some of the questions that they have, to build confidence in our vaccination campaign. This is preventable. We have a very safe and effective vaccine, and we need to do our best to protect the unborn and to best protect our children writ large.
Specifically with this case, are there any other known factors that contributed to the severity of the infant's condition?
There were other comorbidities associated with this child's passing. I don't want to give any personal health information. It was certainly a complex medical condition that the family was dealing with.
And with the tragic nature of this case, will there be a specific investigation into how the mother contracted measles during pregnancy?
There won't be any further investigation. I believe that the family has been provided the appropriate level of care. There were no concerns about the level of care. That the mother had chosen not to be vaccinated. That is our major concern across the province, that we know measles is associated with low birth weights, with stillbirth, with the risk of miscarriage, and in this instance, premature birth. And that's avoidable through this very safe and effective vaccine.
Yeah, overall, the level of concern about the increase that we've seen, the outbreak in measles cases, and really what's being done more to address the gaps in vaccination coverage in this province specifically.
Yeah, we've worked diligently, as our minister had said. We've started in 2023, coming out of the pandemic, to try to increase the uptake of vaccines, given the accessibility and availability during the pandemic. I think our family physicians have done a brilliant job, our frontline nurses, our public health agencies. We've built up that wall of immunity. But there are specific communities, mainly in the southwest of Ontario, farming and rural communities that haven't historically adopted vaccination as part of their health strategy. And we have to continue to work with them. Where we've seen travel cases come back into Toronto or Ottawa, Peel, we've not seen propagation because we've built up a good wall of immunity to protect our communities and protect those that can't get vaccinated. So we have work to do, mainly in the southwest, mainly in pockets of communities where traditionally they haven't taken advantage of vaccination as part of their health strategy.
And specifically, what is the work to do in those communities?
It is really having the one-on-one dialogue, speaking with their healthcare workers, working door to door, working with their community leaders and their religious leaders to ensure that they're aware of the benefits of vaccination, aware of the harms of not being vaccinated, as sadly in this instance, and continue the dialogue and build trust. Many of these communities haven't had trust in government, trust in their local relationships, and that takes time. It can take generations, but we're committed to it in public health, to building that trust in the long term. And I can't thank my public health nurses and physicians in the front lines building those relationships day in and day out.
Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. Dr. Moore, thanks so much for joining us on CTV News Channel today.
Thank you.